Trauma is a state of psychobiological shock and associated distress that typically occurs in response to unexpected events that are perceived as highly threatening or harmful. Shock can manifest as numbness, and research shows that other associated distress typically includes fear, helplessness, or disgust. Others simply define trauma as a psychological injury or as intense emotional distress. The most common definition, which is typically found in clinical or psychiatric settings, is the one promoted by the Diagnostical Statistical Manual. So the DSM quite specifically defined trauma as exposure to actual or threatened death, serious injury, or sexual violence. This definition, to my mind, is problematic due to a number of reasons, primarily because traumatic shock and associated distress can, of course, occur in response to varying degrees of perceived threat or harm or different types of events. If we look at the work of Robert Scare, for example, he found that many of his patients that experienced 10-mile-per-hour car accidents had developed post-traumatic stress disorder. Also, empirical research carried out by Dr. Hammer, who founded German New Medicine. He also found that all of the patients that had suffered a traumatic shock had developed different types of mental and physical disorder. But interestingly, the types of events varied. So, for example, it could include a loved one being diagnosed with an illness, experiencing a miscarriage or stillbirth, feeling abandoned or separated, verbal attacks, manipulation or coercive control, humiliation, rejection or betrayal, family disputes, legal battles, even forced retirement or job loss, unexpected job loss, are just some examples of the types of events that could give rise to the trauma response. Generally, empirical research finds that the key characteristics of trauma are that it encompasses states of shock, emotional distress, it's unexpected, it typically takes people off guard by surprise in comparison to general stress. There's the element of perceived threat or harm, and of course the response is subjective, so there's variability in how people respond to trauma. What's traumatizing for one person may not necessarily be traumatizing for another person. So being forced into early retirement or unexpected job loss may be highly traumatic for one person but not necessarily for another, and the same applies for other event types. However, if we narrowly define trauma as quite specifically characterizing specific types of often violent events, then it overlooks people's experiences, and it has implications for diagnosis and treatment. If, for example, you or someone you care about struggles with a mental or physical health condition that you believe may be either partially or entirely influenced or caused by an unaddressed emotional distress or trauma, then how you understand the nature of trauma will have implications in terms of how you treat it and the modalities that you apply. And therefore, it's important to take the time to try and understand what is trauma, what are the different ways that it's understood. And if certainly from my point of view, if we look at the empirical research, then adopting a definition in terms of effects or symptoms makes more sense, and it's far more inclusive.